Hello everyone, welcome back to my channel. My name is Bertrand. Please be sure to subscribe, share, like and comment. So last week
We had doctors from Mbarara University
and Mbarara Hospital, together with others from Kampala. They came here to teach us about skin cancer, how it comes, and most important, how we can protect ourselves. As people with albinism, our skin need extra care, and learning from those doctors was very important. I also had the chance to interview them, and I am excited to share their advice with you in this video.
Dr. Catherine Julian. I'm a dermatologist working with a skin clinic at Mbarara University, Mbarara Hospital. Today we had an opportunity to come with a team of doctors to visit people living with albinism. We found that in most of these people had challenges with sun protection. Most of the patients had sunburns, had solar elastosis, they had actinic keratosis, a few had the BCCs, and now the challenge was how to manage, because we have to send them to Mbarara Skin Clinic for us to do the excisions, those that we are able to do, and those that we are not able to do, then we need to work alongside with our colleagues, a plastic surgeon and the general surgeons. Another challenge that we have found here is the people are unable to purchase the sunscreens. Much as they are trying to do the sun protection using the wide brim hat, the long sleeved shirts, the trousers and long skirts, but they also lack the knowledge on how to apply the sunscreen, and of which we have done today. We've taught them. We've also added more knowledge on how best they can dress by putting up the collar and then try and protect themselves from the sun. Thank you so much.
So this morning we have been meeting the albino community here in Nachi Valley. So then we had a session, health awareness talk that we have just had that took the patients through the condition, how it comes about, why they have that condition, the genetics of inheritance of the condition, and the effects of color, how it comes about to have that kind of color, why the varying shades of color, why are some too light, why are others a bit darker. So we went through all that, and we also had an interaction between the sufferers of albinism, whereby they gave us their experiences. We explained some of the things that are not understood well, the misnomers, and some of the things, the misinformation that has been going on. So we interacted and gave them the right information about the condition. And then finally we talked about the role of pigment on skin. What does pigment do? What does pigment, what happens if you don't have pigment? And the effects, more importantly, the effects of the sun when you don't have pigment. So that session is well covered. And now we wait to interact with the patients in the clinics individually as they discuss with them to look at some of the rather very private issues that they may be having that they will discuss with us, doctor-patient privacy. Some of the key things that we have addressed is the genetic inheritance of albinism, whereby we have tried to explain in simple terms that the inheritance of this condition is via genes that have mutated, and the inheritance is what we call autosomal recessive, which means that you need two affected genes from both parents to get the condition. So you need a father and a mother who have the condition or who carry the gene, so that if the two people who carry the gene get married, they will likely pass on a normal gene or an abnormal gene to the child. So if for example you have given them an example of whereby two normal color parents, but carrying the gene get together, the chances are that these parents may get one child who is completely okay, does not carry the gene, but also has normal color. But they will have two of their children who will carry the gene, but they will have normal color. And it is one of the four children who will have both genes and therefore have the color of albinism. So that one we have explained. And then a question came from the albinism individuals who are concerned that if for them they are already albinos, how can they have children who do not have albinism? So we told them you can have children who don't have albinism if you choose a partner who does not have albinism, and also decide to test that partner so that you are sure they do not carry the gene for albinism. If you get married to a person who does not have the gene for albinism and is of normal color, the chances are that all the children you will have normal color, but they will carry the gene. So that way you are able to carry on with children who are normal and their normal color, even though they'll be carrying the gene, but somehow as they also get married to normal people, the abnormal gene will diffuse out, since it is a weaker gene. Because inheritance of genes is you have a weak gene and a strong gene, which we call a dominant gene and a recessive gene. So the inheritance of this condition is through a weaker gene, the recessive gene. So as you carry on marrying normal people, the recessive gene eventually weakens out, and you'll be having normal children with several generations that come after you. So we also talked about the different forms of cancer that happen in people who have albinism. And we have observed that the most common one is what we call the small cell carcinoma, or the squamous cell carcinoma. So the squamous cell carcinoma, together with other rare forms like the basal cell carcinomas or the melanomas, they can happen because these individuals do not have the color. They do not have the pigment that causes the color black. So if they don't have this color, the pigment, which is responsible for protecting them from the sun, they will therefore suffer from the effects of not being protected from the sun. And the sun, what does the sun do? It causes damage to the skin. And what does damage the skin because of the sun do? It causes changes on the skin that result into cancer. Okay, so they have to, if they don't have pigment, therefore they have to cover for that one by protecting themselves from the sun. And there are so many ways of protecting themselves from the sun. One of them is, for example, wearing protective clothes. What are the protective clothes? They can wear hats, okay, wide-beamed hats. In Uganda, our president wears them a lot, so we call them the Museveni hat, or the Mama Janet hat, the wide-beamed hat. So that one protects them from the sun, so that the sun does not go through to reach the skin. Then they can also wear long-sleeved shirts and dresses, so that they are also able to protect their hands, their necks, so that the sun does not go through those open places. And then finally, or importantly, they have to wear a sunscreen. So a sunscreen can protect them from the different forms of light. So you have sunscreens that protect people from what we call the UVA light, and that protects them from the UVB light. So the broad spectrum antibiotics protect you from both UVA and UVB, and we would encourage something like that. And also, depending on what we call the sun protecting factor in those ones, which is the For example, if it's a sun protecting factor of 30, it means that you need 30 times of exposure to have the effect of the sun. So if you have a 50 sun protecting factor of 50, it means 50 times of exposure for you to have the effects of sun damage. So the more the sun protecting factor, the better, because you have less, the more times you be in the sun with that strong sun protecting factor, it reduces the damage of the sun on your skin. So that is an important aspect. Sun protection prevents you from getting the bad effects of the sun that come about, like the effects on the eyes, which also come about because there is poor pigment in the eyes. So all those can be catered for by protecting the eyes from the sun, by wearing sunglasses, and then in cases of poor vision, correction of the vision, so that one is able to see far things, and they are able to have a better quality of life in their life, and therefore also improve their quality of life. Eventually, this improves their quality of life and also makes them have a normal life and also live to fullness of life.
Hello, I'm Dr. Denis Okui, a general surgeon, and right here we are at Nachi Valley camp, refugee camp, where we are here with an initiative to try and give some support to a community of people living with albinism. We reached out to by where they told us they're having a challenge with mostly, among other things, skincare for people living with albinism in Nachi Valley. So when they reached out to our friends in Switzerland, we took this initiative to come to the ground and bring a medical camp with a focus on dermatology, skincare. So we brought a team also of consultants and specialists to come and assess the situation, and such that we see how best we can be of support to this team. And so we're here with a team of 8 medical people. Myself, the dermatology, the skincare specialist, the nursing team, people from the lab, and pharmacy support, to see how we can be able to treat and support this team. But most importantly, we want to do an in-depth needs assessment and come out with more ways we can be of support to this community. Thank you.
Thank you for watching. I hope you learned something useful about skin cancer and how we can protect ourselves. A big thank to the doctors who come to teach and guide us. Remember, our health is our responsibility. Let us take care of our skin and spread awareness. Don't forget to like, share and subscribe for more videos. See you in the next one.